Hi, Mr. Kester.
Yes.
My name's Sarah. I'm going to be one of the nurse practitioner students taking care of you today. How are you doing?
I'm doing well. How are you?
Doing good, doing good. First off, we're just going to be doing an abdominal assessment today. I was wondering if I could get your consent to do that.
Of course.
Okay. To start with, if you could just lie back for me. Make yourself comfortable. And if you will, pull your shirt up for me. Just about the rib cage. There we go. Okay, to start with, I'm just going to inspect. I'm looking at the skin color of the abdomen. I see no lesions, no masses, no bruising. There are no abnormal pulsations. There's no hernias. And then next, of course, I would just go straight into auscultation. To start with, what I'm going to be listening for is any bruits, which are any kind of abnormal sounds in the arteries in your abdomen. To start with, I'm going to listen over your aorta here. Listening with both the diaphragm and the bell of the stethoscope. I'm going to move down to the renal arteries. They branch into the iliac. And then down into your femoral arteries here. So what I'm going to do is you wouldn't normally listen over the clothing, but just for the purpose of this exam, I'm going to. And you would repeat on the other side as well. Okay. Next, what I'm going to be listening for is vowel sounds in all four quadrants. And of course, you're making sure that vowel sounds are present and they're not hypoactive or hyperactive. Next, we're going to move into percussion, and essentially what I'm checking for here is to make sure that there's a tympanic sound over the abdomen. Check and make sure there's no dullness, which could insinuate fluid, or of course, if you do hit dull, that could be organ involvement. Mr. Kester, I'm going to be tapping on your abdomen here. If you're a little bit ticklish, this might be uncomfortable, okay? All right, bear with me, okay? Alright, and that was tympanic. Next one I'm going to be assessing for is, of course, the span of the liver. And you do that by the same test, basically, assessing for when you hit dullness. So I'm going to tap just here over this side of the abdomen until I hear dullness. And then I'm going to try to go in between the ribs to find the top of that dullness as well, until it goes back to a more resonant sound, which would be over the lung tissue. So the span of the liver, like I said, you're wanting to make sure that there's no hepatomegaly here. Another thing that you can do to assess the span of the liver is called the scratch test. What you do for that is you actually put your stethoscope in and listen just under the xiphoid process here. And what you're actually going to scratch the abdomen with a fingernail and go up towards where the liver would be. Essentially, the sound isn't going to translate very well through the bowel or through this tissue, but once you actually get up to the solid portion of the liver, then that sound will translate really well. So that's how you can get your liver margins. So essentially here, just going to scratch. I'm sorry, I know you're ticklish. All right. And then, of course, you can get your liver margins there as well. I'm sorry. You did really well. Okay. Next, we're going to be doing several tests, actually, to kind of check for some acute processes in the abdomen. Palpation, I didn't do palpation. Let me go back to that. I'm going to do light and deep palpation in all four quadrants. This is going to be uncomfortable for you as well. I apologize. Let me know if you ever have any pain. Okay. All right. So doing light palpation, and then going to press a little deeper for deep palpation. The liver may be palpable here. We just want to make sure that it's not too large here. While I'm here, I'm actually going to find that costal angle here and kind of hook under it. And take a deep breath for me. Do you have any pain there?
No.
Okay, no pain, no swelling there. That's a Murphy's sign. That would be for liver enlargement or even for gallbladder in that same region. Next, of course, for the palpation, I'm just going to continue on to this quadrant here. Light palpation, deep palpation. Should not be able to feel the spleen here typically. You don't want any kind of spleen enlargement. Going to move down to this area here. Left lower quad, and then deep palpation. Followed by right lower quad, appendix area, light palpation, followed by deep palpation. Any pain there?
No.
Okay, I'm sorry, I know you're ticklish. We're almost done here, okay? All right, next what we're gonna do is, of course, checking for that acute appendix. There's several signs that you can check for that. This area is called McBurney's point. The patient will probably present with some right lower quadrant pain. One sign of an acute appendix is, of course, rebound tenderness, and in order to assess for that, it is gonna be palpation. Typically, you can kind of start a little bit further over because they may be very tender in this right lower quad area. And what you're doing is you're kind of pushing in slowly, releasing quickly. And if on your release the pain is worse, then that's positive rebound tenderness. Over this point here, which would be McBurney's point, would be indicative of an acute appendix. Did you have any tenderness there over that right lower quadrant area?
No.
Okay, next is going to be the obturator sign, which is also an appendix test. What I'm going to do, Mr. Kester, is I'm actually going to lift up your knee here and touch your foot.
Okay.
Going to bend this knee and flex this hip a little bit, and then we're just going to kind of rotate this knee inward. This stretches that muscle right at the bottom of the hip here, and what it will do is it'll kind of put some pressure on that appendix as well. Did you have any pain there?
No.
All right, so that's a negative obturator sign. One thing that's left is going to be the psoas sign, and of course, again, indicative of an acute appendix. What I'm going to get you to do is I'm going to get you to take and raise this leg against my resistance. Let me know if you have any pain, okay? All right, very good. Did you have any pain?
No.
That's a negative psoas sign. Okay, and next we're just going to move on into our musculoskeletal assessment, okay? All right, let me get some tools here. I'll be right back. Okay, Mr. Kester, we're going to continue with our musculoskeletal assessment now. First of all, what I'm going to be doing is I'm just going to be kind of inspecting while you're lying. I'm also going to continue that inspection when we stand up to do some leg tests, okay?
Okay.
So to start with, I'm just kind of looking at your joints. I'm seeing no kind of redness, no, of course, bumps or anything like that. There's no acute swelling, no nodules. Have you noticed any kind of pain or popping or cracking in your joints?
No.
So the patient denies crepitus. And next, while you're lying, what I'm going to do is I'm just going to, of course, I'm going to check for capillary refill. That's what that's called. First of all, I'm going to start with your hands. Actually, can I get both of them and check both of them at the same time? Thank you. Capillary refill is brisk in his upper extremities. While I'm here, I'm going to palpate both of your radial arteries. And if you'll relax those arms down, I'm going to palpate your brachial here. I would repeat on the other side. Now I'm going to move on down, of course, inspecting while I'm going. Like I said, no kind of swelling or warmth, redness, anything like that over any joints thus far. I'm not sure if I'm still in the camera angle. I'm going to check capillary refill of the lower extremities down here, which is also brisk. And while I'm here, I'm sorry, I know you're ticklish. I'm going to do a couple more pulse assessments. I'm going to be checking the posterior tibial, which is on the inferior or interior part of the leg here, right on the inside of this ankle. I can lift. And then I'm going to be checking the dorsalis pedis, which is where it kind of wraps back around to the front of the foot here. And I would check that bilaterally as well. Okay, all that's within normal limits. Mr. Kester, if you'll stand up, next we're going to do some range of motion exercises.
Okay.
Okay, to start with, let's just check your neck. While you're standing up, I'm assessing your posture. You're upright, unassisted. Everything looks to be equal side to side. So to start with, what I'm going to need you to do is touch your chin to your chest. Look up at the ceiling. Can you turn your neck side to side for me? And can you touch your ear to your shoulder? Okay. All right. And then next, let's go ahead and check your shoulders. Okay. What I would like for you to do is bring your arm out away from your body. Okay, that's abduction. And then if you can bring it across your chest, adduction. Okay. Do that with both arms for me, if you will. All right. And then can you bring them straight up? Can you just put them straight out? Very good. Now, from a kind of straight up like this. There we go. Okay. And then what I want you to do is put those down, and I want you to take your right hand, and I want you to try to scratch your left shoulder from the back like this. Okay. I'm assessing. And then if you could go over the top as well, that same kind of stretch. Okay. And repeat with the other arm for me. Okay, very good. And let's go ahead and check your elbows, okay? Let's bend those elbows in, stretch them out for me. All right, let's do that one more time, but against resistance, okay? Checking your strength here, okay? And then push away. All right, very good. Now let's go ahead and check your wrists while we're here. What I want you to do is, still assessing your elbows kind of, what I want you to do is first turn your palms up. Back over some camera angle, thank you. Palms up. Palms down, that's supination and pronation. And then let's go ahead and just assess your wrists and your fingers. You can bring those wrists inward, outward, and kind of rotate them. Very good. Okay, it's inversion and eversion. And then let's go ahead and check your fingers. Just kind of do a rapid finger tap for me. There we go. All right, and squeeze them all together, stretch them all out. Very good. All right, moving down. Let's see. Let's go ahead and do, let's check your back really quick while you're standing. And then I'm going to move down and have you sit and do your knees and your ankles and all, okay? So the first thing that I want you to do for your back is I want you to bend forward and touch your toes for me. Okay, and you can stand up. And now I want you to lean as far back as you can without hurting yourself. Very good. Okay. Now what about a lateral bend? Can you bend to the side? Very good. And to the other side? All right, awesome. And can you rotate? Just like that, perfect. All right, full range of motion there. All right, you can have a seat for me. We're gonna go on down to assessing your hips and your knees. First off, I'm gonna start with your knees, okay? What I want you to do is basically just pull these both out towards me. All right, extension. And then if you'll scoot towards the edge of the bed as much as you can and kind of bend those knees. Yep, very good. Very good. All right, and your ankles, let's go ahead and flex those up towards you, point your toes towards you. Now point them straight down at the floor. Now let's twist them both inward and outward. And let's rotate them both all the way around. Little snap, crackle, pop there, huh? A little bit. Okay, let's wiggle those toes for me. Stretch them out if you can. Very good. All right, if you'll lie down, let's do some hip tests, okay? All right, first of all, what I'm gonna do, is I'm gonna do, just a leg raise, okay? You okay there? Mm-hmm. All right. Just on the other side here. Very good. All right, now what I want you to do is I want you to take this leg and I want you to kind of just drop it off. I want you to kind of push it out away from your body and then drop it off the side of the stretcher. All right, now bring it back. And if you'll repeat with this other side. All right. Very, very good. Very good. Okay. I'm going to be checking a couple more things while I'm here, okay? First of all, if you'll reach both your hands up and grab my hands, I'm going to be checking your grip strength. Squeeze me as tight as you can. You're not going to hurt me. Very, very, very good. Okay, we've already assessed, of course, the muscle strength here with your elbows. Next, what I'm going to do is I'm going to get you to sit up again. I hate to do this up-down thing. And you can turn over towards the side of the bed. All right. I'm going to be checking your shoulders, a shoulder shrug. All right, very good. And a neck turn. I'm going to place my hand here. Turn your neck. Turn your neck. All right, the shoulders and the head turn, that's spinal accessory muscle, that's cranial nerve 11 that's intact. And I'm also, of course, assessing his neck strength and his shoulder strength. So we've already done arm strength. Let me go ahead and check your knees, okay? What I'm going to do is I'm going to get you to resist my movement here, okay? Resist me. Now push me away. All right, same on the other side. Resist me. Push me away. Okay, let's do wrists as well. Just go ahead and assess your wrists, okay? What I'm going to get you to do is try to resist me pushing you back. Pushing you. All right, now push me. Okay, and same thing with feet. What I'm going to get you to do is push me, resist me. All right, very good. All of that seems to be in order. Next, we're going to move forward to some very specific musculoskeletal tests. And essentially what this does is it checks for any kind of abnormalities with any kind of any joints, any ligaments, anything like that. let's go ahead and start with, since you're sitting like this, let's go ahead and do some knee assessments. Actually, I do need you to lie down for this one as well. Okay, let me come around here. Okay, so there's several tests that actually assess the knee, and what we're looking for is any kind of ligament injury here, or any kind of effusion. So one thing that I can do is the bulge test for the knee, and what I'm doing is kind of pushing that patella, and I'm pushing on the outside of it. Let me know if I'm tickling you or hurting you. And what I'm doing is I'm trying to displace any kind of fluid so that I can see it on the opposite side, and that's a negative bulge test there. Like I said, this would be an effusion over a large joint. Some other tests that you can do to the knee is looking at the ligaments for any kind of ACL injury or any kind of other ligament injury, and that actually includes, let's do a drawer test, okay? So what I'm going to do is I'm going to bend your knee here, and what I'm going to do is I'm going to kind of push here and see if I can get that, get your tibia to kind of slide away from your femur here, and I'm going to pull it as well. All right, there's no movement there. That's the drawer test. I would repeat for the other side. Another one that we can do is, if you'll straighten this leg out a little bit, I'm going to do kind of a 15-degree extension and a 15-degree flexion there. Okay. All right, so what I'm going to do is I'm going to stabilize the femur here, and I'm actually going to also put my hand on the tibia. I'm going to find that joint space here, or the joint line here. And what I'm trying to do is I'm trying to hold this femur still while I am able to move the tibia, and I shouldn't be able to really feel any movement there. That would, of course, indicate either a tear or a ligament injury back here. Another one that I can do is the varus and valgus test, and that's assessing these ligaments along the side of the knee. What I would do for that is actually just place my hands on either side of the knee. I'm going to be moving you around a little bit, I'm sorry. And I'm going to try to push that leg inward and feeling kind of movement or pain of that ligament there. Do you have any pain during that?
No.
Okay. And then I would go to the exterior side of that knee and try to externally rotate that as well. Any pain there?
No.
Okay. Now that would be, of course, repeated for the other side. Multiple tests here, really, with the musculoskeletal system. Next one that I can really think of is going to be assessing your wrists. We can actually, it's going to be kind of awkward, but we can actually do that right where you're at.
Okay.
What I need you to do, if you can kind of look at me, is I need you to take the backs of both of your hands and put them together here and hold them. And what this is assessing for is any kind of carpal tunnel. If these fingers went numb after about a minute or had any kind of tingling or pain, that would be positive for carpal tunnel. Okay, you can relax those arms. Again, we would do that for a minute in the normal, clinic setting, but not for the purpose of the video. All right, next what I'm going to do is I'm just actually going to kind of tap. I'll come around for this one so it's easier for the camera to see. This is also checking for carpal tunnel, and what you're going to do is you're going to start kind of limited for space here. But what you would do is you just kind of tap along this nerve here, and you let me know if you have any kind of tingling with the fingers.
None.
At all? Okay. All right. Another structure that I kind of want to point out right here is the snuff box here. You'll have a lot of fractures hide there. Another test, what I'm going to get you to do is tuck your finger in here, tuck your thumb in, and just make a fist around that. And I want you to take that fist and I want you to bring it downward like that. Okay. Any pain there?
No.
Okay. No pain over the snuff box? All right, very good. Let's see what else we've got. So far we have assessed the Phelan test, the tenor, the tinal test. We have done the varus and the valgus test. We have done, let's see, the drawer test. We've done the Lockman test. We did not do McMurray's. And essentially what I have to do for McMurray's is put my hand on your foot here, one on your knee, bring that up to a 30-degree angle, internally rotate, and externally rotate. Any pain there?
No.
And that's checking your ACL. Okay. All right. Do you need a break? Do you have any questions thus far?
No, ma'am.
Okay, we did the bulge test. If you'll stand up for me, or actually just sit up, I have a couple more tests for me. The next one we're going to do is called a Hawkins test. I need you to bring your arm in front of you like an L. All right, and what I'm going to do is I'm going to apply some downward pressure here, and it's going to essentially tighten up in this area right here. Do you have any pain in there?
No.
All right, and that's looking for any kind of ligament injury or bursa injury in that area of the shoulder, or tendon, tendon or bursa inflammation. We did Finkelstein's test with the wrist, and that was looking for de Quervain's tenosynovitis. Next, I need to assess your shoulders a little bit more. What we're going to do is a drop test. I'm going to get you to put that arm directly out, and I want you to bring it down slowly. Okay, it's all the way down to your hip. And what I'm assessing for here is that it's a smooth motion. If he had any kind of rotator cuff injury or a rotator cuff tear, it would be more of a mechanical of a drop. Let's see what else we have to do. Okay, Sperling test is going to be assessing for cervical radiculopathy. Have you had any neck pain?
No.
Okay, so what we would get the patient to do is go ahead and just kind of tilt your ear towards your shoulder. All right, any pain there?
No.
And if that didn't elicit a response, you can apply pressure. Don't let me pop you here. Kind of towards this shoulder that he's leaning towards and downward. And do you have any pain or tingling there?
No.
Okay, so that's Sperling's test. All right. That concludes our musculoskeletal exam. Do you have any questions so far?
No, ma'am.
Okay. Okay, so we're going to move forward with our neurological exam. I'm just going to speak with the camera really quick. Dr. Wright, I know you were concerned last time for the HENT assessment about the pocket Snellen. It's Prestige Medical, and instructions say to hold it 6 feet from the patient in good light to assess the eyes. I guess it's just the size of the chart. I've also got my reflex hammer and my pen light here, so we're going to start with our neuro exam, okay? All right, to start with, Mr. Kester, what I'm going to get you to do is we're going to talk a little bit. I'm going to kind of be assessing your judgment, kind of your demeanor as part of my neurological exam, okay?
Okay.
All right, so to start with, what I want you to do is I want you to remember 3 words for me, okay? I want you to remember fire, dog, and truck. Can you think you can do that?
Fire, dog, truck.
Fire, dog, truck. Okay, we're going to continue having a conversation. We'll come back to that later, okay?
Okay.
All right, first off, I want you to tell me what a river and a lake have in common.
They're both bodies of water.
Okay, what about what basketball and football have in common?
They're both sports. They're playing the ball.
Okay, all right, so his judgment is, or his abstract thinking is intact. Mr. Kester, if you came up on, let's say, a stray dog, what would be your first move to do?
Look for the owner.
Okay, very good. So his judgment is intact. We assess abstract thinking with, of course, the relating of, I guess, unrelated objects to each other. And what I'm going to do is I'm going to kind of move forward now into assessing your cranial nerves, if that's okay with you.
Okay.
A few of these we did in the HENT assessment, so I'm not going to hit on them again. I'm just going to discuss them. So for assessing our olfactory nerve, which is nasal, that's when we held the alcohol swab under your nose and you identified that with your eyes closed. Next, with your cranial nerve 2, that's when we did the Snellen. So essentially what I'm going to do is I'm going to get you to just kind of check your vision really quick. We can just run through it really quickly for the sake of the video.
Okay.
All right, go ahead and read the top line here for me.
E.
Okay, and just continue on down to the lowest line you can read.
L, T, FPH, OLCF, DHJ, BS, EPTZO, CFDHJ, LTFPH.
Okay, and he indicated they had 20/20 vision, which means that he can see at 20 feet what a person with normal vision or perfect vision can see at 20 feet. So that determines that cranial nerve 2 is intact. Cranial nerves 3, 4, and 6 all include kind of extraocular movements as well as some pupil reactions. If you could just slide your glasses up to the top of your head for me really quick. All right, thank you. First of all, what I'm going to assess, I'm going to get you to close your eyes for me. And I want you to try to keep your eyes closed while I'm pulling your eyebrows up here. Okay, very good. You can open your eyes. I'm going to be checking your pupil size and reaction. Okay, close your eyes. All right, other side. Pupil size, reaction. All right, pupils are equal, round, and reactive to light. Next, we're going to check for extraocular movements. What I want you to do is follow my pen light with your eyes, not your head. Okay?
Mm-hmm.
Checking the cardinal fields of gaze here. All right, very good. There's no nystagmus, no drift. That means that cranial nerve 3, 4, and 6 are intact. Next, we're going to check accommodation. I want you to follow this pen light towards your face. I'm watching his pupils move towards and of course, constrict to focus on this object. And again, 3, 4, and 6 are intact. Next, what I want you to do, what a piece of gum was, I thought I picked one up. We're going to be assessing cranial nerve 5, which is going to be your trigeminal nerve or your facial nerve. And we're assessing for light touch here, okay? So what I want you to do is I want you to close your eyes for me really quickly, and I want you to tell me where you feel me touch.
Left cheek, chin, forehead, right cheek.
Okay. Trigeminal nerve or cranial nerve 5 is intact. Next, we're going to assess your other facial nerve, which is going to be cranial nerve 7. I want you to puff out your cheeks. Smile really big for me. All right, frown. Very good. All right, facial expressions indicate that cranial nerve 7 is intact. His conversational hearing has been normal for this exam, and we also did the invasive ear exams, the Weber and the Rene test during the HENT assessment, so I know his cranial nerve 8 is intact. Let's see, if you could open your mouth for me, stick out your tongue and say ah. All right, I'm watching his soft palate and uvula rise when he says ah, which means that cranial nerves 9 and 10 are intact. We did cranial nerve 11, the spinal accessory nerve, earlier during our musculoskeletal exam. That was assessing your neck strength. And then cranial nerve 12 is going to be your tongue strength. What I would do if I had a tongue depressor is I would get him to try to push the tongue depressor with his tongue and also watch his tongue movement. So if you could just kind of stick your tongue out side to side. Okay. So the, hypoglossal nerve is intact. All right, very good. Moving on. Next thing we're going to do, I'm going to put this stuff down here. And next what we're going to do is do some deep tendon reflexes. While you're sitting up, I'm going to go ahead and do your patellar reflexes. These can be kind of uncomfortable, so I just kind of want you to bear with me, okay? All right, so your patellar reflex. All right. There we go. Okay, there it is. All right, we're also going to check the Achilles back here on the back of the heel, right over that Achilles tendon. All right, I watched this foot dip, and same with the other side. Next one I'm going to check is going to be your brachioradialis right here over the wrist. And I'm just going to tap here, and what I'm watching for is a little kind of flex of your fingers. This one can be a little bit difficult for me to find sometimes. There we go. Okay. I would assess that in both sides there. There we go.
Got that time.
Sorry, got it that time. All right, and then we're also going to check your brachial here, or your biceps, not your brachial. It is your brachial. All right, and what I'm looking for is a little kind of twitch down low there. This one's also kind of hard if you don't do it all the time. Just relax that arm. Just relax it. There we go. All right, what I'm looking for is his hand to move. I'm not going to waste time trying to do it. Obviously, if I couldn't hit it, if I hit it and it didn't actually show up, then that would be decreased reflexes. Next, I'm going to check your tricep, which you just kind of loosen up and let me have that. Mm-hmm. Okay, there we go. And I'm going to tap right here. There we go. And I watch your lower arm move there. And I would repeat that test on the other side as well. Okay? All right, so that concludes our reflex examination. Got a few more neurological exams for you. To start with, what I want you to do is some rapid alternate movements. I want you to take your fingers and just kind of tap like we did earlier towards your thumb as quick as you can. Fast, fast, fast. Very good. Okay. All right, really quick, since a little bit of time has elapsed, why don't you tell me those 3 words that we talked about earlier?
Fire, dog, truck.
Okay, his memory is fully intact. For a couple more tests, what I'm actually going to do is do some more rapid alternating movements. Let me get you to, I want you to take your legs onto your knees like this, and I want you to just tap with the backs of your hands and then alternate with your palms as fast as you can. Okay, that's sufficient. Rapid alternating movements are intact. And then, like I said, we're just going to kind of move forward a little bit. Another thing that we can assess is your heel to shin. I want you to take your heel of your left foot, place it near the knee of your right leg, run it down towards your foot, and all the way back up. Very good. Switch and do the other side, please. All right, heel to shin is intact. Stand up for me. Let's go ahead and do a Romberg. Alright, what I want you to do is I'm going to place my hands on either side of you. I want you to close your eyes, and I'm just going to watch and make sure that you don't drift side to side, okay? Alright, I would assess for several seconds to make sure that he was stable and wasn't going to drift. Alright, next you can keep your eyes closed. I want you to put your hands directly out in front of you like this. Let's make sure we're still in the camera angle. And I'm looking for pronate or drift here as he closes his eyes. A positive pronate or drift would be if one hand dropped to one side or the other. Okay, you can relax there. You can have a seat for me. Let's see if there's anything else that we need to touch on. Okay, we're going to do some walking at the very end of it. The next thing I'm going to do is I'm going to place an object in your hand, and I want you to try to identify that object just based on touch. I want you to have your eyes closed, okay? But first of all, I have to find that object. Found it. Alright, stick out your hand for me. I'm going to place an object in your hand, and I want you to identify that based on touch. What does that feel like?
Feels like a house key.
It is a house key. Alright, so spheriognosis is untied. Alright, place that back over here. Let's see. Stand up for me. And what we're going to do is some walking. I'm just going to assess your gait. What I'll get you to do is start to that side of the room, please, and just walk towards me. Okay, that's good. And if you will turn, and what I want you to do is I want you to do a heel to toe or tandem walking all the way to the other side of the room, please. So I'm watching. Of course, while he's doing that, his heel to toe is successful. He's not off balance. So of course that test came back within normal limits. Okay. Trying to think that, do you have any questions thus far for me?
No, ma'am.
Okay. Let's do. Cerebellar coordination. I need you to close your eyes. Put both of your hands out to your sides. And I want you to take and touch your finger to your nose with your right hand, and then repeat with your left. Okay, very good. All right, you can have a seat for me. All right. Okay, Mr. Kester, just a couple more components of our neuro assessment will be finished. If you could lay back for me and put your feet up on the stretcher here. I'm going to be doing a couple more neurological assessments here. One thing that I'm going to be doing is I'm going to get you to close your eyes. We're going to test something called proprioception. Close your eyes for me. What that is it's a position sense for you. I want you to tell me which part of your body I'm moving and in which direction, okay?
Okay. My left big toe down.
Okay, and opposite?
My right big toe up.
Okay, very good. While I'm here, I'm going to be assessing a couple of reflexes. I'm looking for the Babinski reflex. This may tickle. I know you're a little bit ticklish. I'm just going to run a dull object across the base of the foot, and what I'm looking for is that in an adult, those toes will pull downward. An abnormal reaction to that would be the fanning of the toes that is normal in an infant, but of course not common as you go on into adulthood. While I'm here, I'm also looking for any kind of clawness, which would indicate either spinal or some kind of neurological issue. That would be some kind of rapid movement of the foot. I'm also going to do dull and sharp touches here, and I want you to identify which one you have, okay?
Dull, sharp, sharp, dull, dull.
Okay. And moving on to your upper extremities here. Same test.
Dull, sharp, 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 dull.
Okay. All right, Mr. Kester. Do you have any questions for me?
No, ma'am.
All right, that concludes our, it's been kind of an extensive assessment, our abdominal assessment, our musculoskeletal assessment, and our neurological assessment. If you don't have any questions, that concludes our exam. I appreciate you being such a good patient.
Thank you.
Thank you.